Last class I discussed about the anemia. Is anemia, types of the anemia, then etiology, then one most important anemia is iron deficiency anemia. Already I discussed last week. Today I like to highlight with aplastic anemia. Very much important in our clinical practice. It's very much important in our clinical practice. Remember this. What is aplastic? Aplastic anemia. Aplastic anemia may be defined as hypoplastic and aplastic of the bone marrow associated with, coupled with pancytopenia. Remember this one. Initially there is monocytopenia or bicytopenia. Remember this one. Now, heart. What is the cause? What is the etiopathogenesis? Cause looks to your book. It is consequence of a stem cell failure. It is consequence of a stem cell failure. This is SEEDS theory related to drug, toxin and virus resulting from cell-mediated or antibody-dependent hypertoxicity. Is it? Next one is the abnormality of microenvironment. Abnormality of the microenvironment. This is called soil theory resulting from drug, toxin and virus and immune-mediated mechanism. Remember this one. Next one is for the classification. Low yearbook. What is the classification? Classification broadly two types. One is congenital, another one is acquired. Congenital means Fanconi's anemia. Congenital familial aplastic anemia. Then Schwarz-Diamond syndrome. Then Diamond-Blackfan anemia. Remember this one. These all are congenital aplastic anemia. Now the acquired. Acquired are again two types. One is primary. Primary means idiopathic. Then secondary. Secondary means due to drugs, toxin, chemicals, radiation, and some viral infection. What are the virus? Epstein-Barr virus is most culprit. More culprit virus is Epstein-Barr virus. Then cytomegalovirus. Then hepatitis B virus. Then HIV virus. These all of the virus causes the aplastic anemia. Remember this. Now how the patient is present to you. Due to there is a bone marrow failure. Due to their bone marrow failure, so their first time there is a pancytopenia. Patient comes with pancytopenia, that is due to thrombocytopenia. Due to thrombocytopenia there is a bleeding manifestation. Due to thrombocytopenia there is a bleeding manifestation, skin bleeding, nose bleeding, gum bleeding, rectal bleeding, and skin bleeding. Remember this one, because all are due to thrombocytopenia. Remember this. Next one is due to neutropenia. Due to neutropenia there is infection, that is fever and variable infection. Remember this. Go through your box, everything in your box. Next, due to anemia. Anemia comes lastly. Lastly come anemia due to RBC failure. Remember this one. Now, another types of classification of aplastic anemia is mild, moderate, and severe types of aplastic anemia. Mild, moderate is very well. Then severe means when bone marrow cellularity is less than 25%. When bone marrow cellularity is less than 25%, this is a severe form of aplastic anemia. Remember this. I told you I given the clinical manifestation. That is bleeding manifestation, infection with fever, then failure is coming last. Failure means anemia come last. Remember this. And from anemia, due to anemia there are some consequence: fatigue, failure, palpitation, congestive cardiac failure. This is the manifestation of the anemia. Remember this. Next, you go for the investigation. What is the investigation? What is the investigation? Complete blood count. In complete blood count there is a pancytopenia. Complete blood count there is a pancytopenia. Remember this one. Peripheral blood film there is a normocytic normochromic anemia. Finally, you go for bone marrow study. Go to your bone marrow study. What are the findings of the bone marrow finding? Look, there is a hypocellular bone marrow with empty spicule. There is increased fat cell into the spicule, increased fat cell, and there is also the plasma cell and lymphocyte will be increased about this one. This is the bone marrow finding. Now the treatment. Another one. Before treatment, another investigation is you must be do karyotyping. To see the chromosomal breaks. In a plastic, what happened? Chromosomal breaks. Remember this one. Now what is the treatment? Treatment is supportive treatment and a specific treatment. Go through your books. Treatment is supportive management and a specific management. Supportive management due to the anemia, to blood transfusion. Give the blood transfusion correction of the anemia. So keep the hemoglobin concentration 8 to 10 gram per dl. Remember this. Blood transfusion. Due to thrombocytopenia, due to bleeding manifestation, there will be platelet transfusion. Okay? Platelet transfusion. Then due to already I given to this infection. Due to infection, control the infection, given the broad spectrum antibiotic, empirical treatment with broad spectrum antibiotic. This is ampicillin and gentamicin or ampicillin and cloxacillin or third generation cephalosporin, ceftriaxone and cloxacillin or meropenem and cloxacillin. Remember this one. Treatment should be given 7 to 10 days, 10 to 14 days like this. Remember this one. This is the supportive treatment. Now you go for another treatment is the growth factor. Growth factor. This is growth factor. What is growth factor? GCSF, GMCSF. G money granulocyte. G means growth factor. Colony stimulating factor. Granulocyte, colony stimulating factor. Then granulocyte, monocyte, colony stimulating factor should be given, and it is in the market available as a name is filgrastim. Given 20 milligram per kg of the body. For 20 milligram per kg of the body given IV infusion. Then what happened? What will do this growth factor? What did? What is the advantage of the growth factor? It stimulates production, maturation of the neutrophil. Remember this. It stimulates maturation and production of the neutrophil. Remember this one. Now the immune therapy. Another module of treatment is immune therapy. Cyclosporin A, ATG and ALG, anti-thymocyte globin and anti-lymphocyte globin should be given. Finally, we should be given, sometime we given the methylprednisolone. 20 milligram per kg of the body given. 2 to 4 weeks like this. Finally, a final treatment, that is a specific treatment is bone marrow transplantation. Remember this. Bone marrow transplantation is the final treatment of the aplastic anemia. Thank you very much for patient hearing. Okay.